make smart, patented pill bottles that improve medication adherence. Today, I'm going to give you a brief introduction into our company, and then I'm going to spend some time talking about our design philosophies, many of which can be applied across the healthcare industry at large. So the problem that we're solving is that of medication adherence, which basically means people taking the right pill at the right time. Medication adherence rates are about 60% on average, and low medication adherence is arguably the most costly problem in healthcare today, contributing to about $300 billion in increased costs and $100 billion in lost revenues every year. So that's why we created the Adhere Tech bottle. Here's how it works. Every time the patient uses this bottle, 2 pieces of data are automatically sent into the cloud. Number 1, a timestamp of the open and close of the cap, and number 2, a measurement as to how much medication is removed. Our servers then analyze this data, which basically tell us how many pills a patient took and when they took them, and we compare it to a patient's recommended dosage schedule. If we notice a discrepancy, like the patient didn't take their pills, they took too many, they took too little, then we intervene. And we intervene in 2 ways. So if you'll direct your attention to the bottle in my hand, I'll show you the first way. So during the optimal dosage time, the time the user should take their pills, the bottle glows blue, sort of calling the user over, saying right now is the right time for you to take your medication. And once that optimal dosage time has passed, the bottle flashes red, it beeps, and this is when the user would get that second form of intervention, which is an automated phone call or text message alert. So we have on-bottle alerts and phone alerts as well. And this bottle has many uses, but it's ideal for patients on fixed-dose combination drug therapies or for the single most crucial drug in a patient's regimen. In just a few short weeks, we'll be beginning trials with some top-tier institutions. We've already secured trials with Cornell University, the Walter Reed Army Medical Center, right here at Stanford University, and various hospital systems. The designs of our trials do vary, but each one is basically comprised of, on the one side, a control group, basically receiving the status quo level of treatment, and on the other side, a test group, receiving Adhere Tech's bottle plus reminders. And we're testing a number of different metrics, most notably the degree to which we improve medication adherence. And we're also testing it for a number of different disease states, including HIV, cancer, transplant meds, CHF, type 2 diabetes, and blood pressure. And I'm also really pleased to announce that in early 2014, we'll be beginning our pharma trial with Boehringer Ingelheim. We're extremely excited to begin a relationship with this company. And the goal of all of these trials is to secure or to collect really valuable data, which we can then leverage to secure a partnership with a large healthcare organization. So our bottle has many applications, but 3 really stand out. So first, we want to distribute high-cost specialty drugs in our bottles. We will increase adherence, refills, and ultimately revenue for the pharma company, and we want to charge the pharma company for this service. Next, with the Affordable Care Act, hospital readmissions for certain disease states are now highly penalized, and the number 1 reason why patients are readmitted into the hospital is because they don't take their meds. So we want to discharge patients from the hospital with our bottle to reduce the readmission risk. And finally, we're really excited about the application that our bottle will have in the clinical trial and research space as a tool that increases adherence and accuracy and reduces the time and cost of these trials. So now on to our design philosophies. So there are a number of them, but they all really fall into one of 2 categories, making this bottle really easy to use or making it very versatile. So we wanted to create something that requires 0 setup, a product that patients could get from a doctor, a hospital, or pharmacist, and it would just work. So that's why we decided to put a wireless module inside of this bottle, so it automatically sends all data over the Verizon data network, just like a cell phone. This means patients don't have to sync it to Wi-Fi or Bluetooth. They don't have to plug in a base station. Our bottle works automatically and immediately everywhere, just like a cell phone. We also didn't want to interrupt the existing workflow of a patient. So patients use our bottle just like a normal bottle. The only difference is it looks different. Patients open and close it like a normal bottle. They pour out medication like they would from a normal bottle. It even uses a standard childproof cap. And the bottle itself has a 45-day battery inside. So that means for a typical 30-day prescription, patients never have to charge it. But for a 90-day prescription, they would charge it once overnight using the standard micro USB port on the bottom of the bottle, once again, just like a cell phone. We also thought it was really important for all data to be collected and analyzed in a purely passive manner. We didn't want patients to have to respond to push notifications or press any special buttons, so our servers automatically receive this data, automatically analyze it, and then if we need to get in touch with a patient, we simply send them a message. And we also are able to know when there's only a few pills left inside of the bottle, so we can automate refills, which benefit both the patient and the pharmacy. And this bottle is really easy to use, even for the non-tech-savvy patient. So you don't need to download any apps to use this. You don't even need to use a cell phone. Like I said before, you use this just like a normal bottle, except when it's time for you to take your pills, it will light up. And then if you miss your dose, you get that reminder on a landline. We also realize that patients are really different, and they respond to different stimuli. So we made this bottle completely customizable. Not only can patients receive reminders, but these reminders could also be sent to caregivers or family members as well. And some patients may prefer a text or email alert, so it's very easy to switch from the default phone call to one of these using our secure online web portal. We also automatically generate charts that show a patient's adherence over time, and both patients and doctors will have access to these charts. And if a patient needs to change their dosage schedule midway through prescription, our bottle can easily accommodate that. So because patients are different, they also don't take their pills for many different reasons. So we wanted to create a bottle that identified all of the leading drivers of non-adherence and could combat each one of them. So the number one reason why patients don't take their meds is because they forget. So quite simply, we send reminders when they forgot to take a dose. However, sometimes patients don't take their pills due to side effects, monetary issues, lack of information about how the drug works, or their symptoms are gone, they think they're cured, they think they don't need to take their meds anymore. So what we do is we solicit feedback. When we deliver that reminder to patients, we also ask them why they didn't take their pills so that we can deliver the right intervention on day 1 as opposed to day 30. And we're currently working with top behavioral economists to find out the right way to ask those questions and what to do with that data once we receive it. And finally, for some patients, medication adherence is simply a low priority. So we decided to build our bottle with an open API, or our server with an open API. This way we could integrate with all those great adherence apps and health apps that are out there. And this also facilitates partnerships with healthcare organizations as well. So finally, we not only wanted to create a bottle that worked really well, we wanted to build something that looked really pretty to encourage usership. So I'll walk you through some of our design choices from the top down. So we decided to go with a clean white plastic casing so that the bottle looked familiar and trustworthy, much like a medical device you'd find in a doctor's office or hospital. We also wanted to build a vertical window into the bottle so that patients could see how many pills were left, and this vertical window lights up to make the bottle feel alive. The side of the bottle is very flat, which allows for easy application of a prescription label. It also allows the patient to read this label very easily. And the bottle itself is designed to the contours of the human hand, so it's really easy to hold, grip, twist, and open. It has a 30 dram volume, which means that it could hold about 90 of those jumbo daily vitamin pills. And the size of the bottle is that of about 2 standard pill bottles side by side. Future versions will, of course, get smaller, but this still allows it to fit really easily into a medicine cabinet or into a bag. We also put a rubber foot on the bottom of the bottle to protect it from what might be a damp countertop. And these rubber feet will come in different colors to help differentiate bottles. And finally, the electronics are kept in a secure and sterile chamber, which is totally separate from the secure and sterile chamber where the medication rests. So it was truly such an honor to present to you today. If you have any questions or if you want to learn more, please feel free to contact me and my team at info@adheretech.com, or you could follow us on Twitter at @adheretech. Once again, my name's Josh. Thank you very much.